No, it's one of those things where it followed the human model. You know, it makes sense. If you're, if you're, I know you're an athlete, so you think about the things that you're doing to stay in condition and performance and prevention. The same holds true for dogs. So whether it's a companion animal or a canine athlete or a working dog, rehab's so important. And so you're mentioning geriatrics, but it starts way, way, way before that. Even with young dogs, there's so many genetic dysplastic conditions, elbow dysplasia, hip dysplasia, things that luxating patellas, OCD, I mean, the list goes on and on of things that happen to puppies. And so those puppies are then plagued with not only the need for some sort of therapy, maybe surgery, but then therapy afterwards. So really where, quote unquote doggy rehab comes from is if you follow the human model, it just makes sense. If you're, pediatrics playing soccer and you injure your knee, it happens in kids quite commonly here in the States. They're off to physio, they're off to PT. So I think we've done a really good job, or I'd say we are improving in veterinary medicine, trying to do a good job of really advancing the science and the clinical application of rehab for dogs. So I liken it to sort of the human model.
And we entered into this, what, 15 years?
2005,
a long time ago,
yeah.
when it wasn't very popular and it wasn't very common, and we just said, well, we have an injury, everybody goes to rehabilitation, and why would we offer that to our dogs and cats also? And so it made complete sense, and it makes sense to people too. They're just like, well, my dog just had surgery, so I just don't let him run for 12 weeks and then I let him run. How does that work? And so it's just an amazing process now that we can get dogs up to great muscle mass and good physical ability. And then for our older patients, we can get them more comfort than we used to. We would just watch them lay there and not move a lot and just say, oh, they're old. Maybe we should put them down because they can't go for their walk anymore. And now they're beating us on the walk.
Or just give them pills. The big answer lots of times with most veterinarians are, oh, here's some pain medications. Here's some pain medications. And, all of a sudden, here's the geriatric dog that's already painful and arthritic, and now he's just stoned laying on the floor. And it's like, no, we got to get him moving. That's the best thing we can possibly do. So the physio aspect all the way around, I think, is important from puppy up to geriatric.
Yeah, of course. And at that point, when they are getting older, they're part of the family, and you don't want to be doing that. You don't want them to see that, have that quality of life at that point. So anything we can do to avoid that is perfect. You did mention puppies there for a moment. Are there more breeds that are more prone to some of these injuries than others?
Unfortunately, yes. So I don't know what we're allowed to say on this live interview because we don't want to insult anyone.
We can't go to dog parks anymore. We go to dog parks, we're like, oh, that breed. Or our son will come to us and say, his friend wants to get a dog breed. What do you think? I'm like, no, not that one.
Not that one. Not that one.
Not that.
Yeah, we'll be in Washington, D.C., just driving down the street, and the dog parks are everywhere. And we're like, we see this limping dog. We're like, don't look. Just don't look. It's very, So unfortunately, many breeds, whether they're toy breeds all the way up to giant breeds, are plagued with genetic, conditions that they can have. And then as they become middle-aged and seniors, then we have to worry about bone cancers and other types of cancers as well. So unfortunately, whether you're a teeny little Chihuahua, you're a Yorkie, luxating patellas are common, all the way up to a giant breed with dysplasia, unfortunately, we can see it. So there's no breed that I'm aware of that doesn't have some condition that we've seen. And the challenge now is all these boutique breeds.
Oh,
so let's take a golden and a poodle and make a doodle of some nature, or a mini. They're taking giant breeds with mini breeds, and now you're taking these dogs that were not meant to have certain conformations, if you would, and we're creating that. And it's great for us as orthopedic surgeons and sports med doctors and rehab. Not great for the canine population. So we have to, you have to be really, really.
What would be, if we are talking about that puppy stage, what would be some of the early signs that we need to look out for to understand that, okay, we might actually need to, see some professionals like yourself to understand what's going on?
Yeah, I think, a couple things. The activity level, for puppies, they should be active and want to go for walks and, be able to kind of get up and down with ease. And so if we don't see that, we want to get them checked out. A lot of the, congenital early signs, like say hip dysplasia or hip problems, they tend to do this classic bunny hop where their back legs stay together and actually bunny hop through a field, or if they're running or anything like that. So that's like a classic sign if there's a back end problem. And then the front end is usually limping, usually just kind of off gait.
Yeah, it's quite, the frustrating and challenging thing is so many owners come in to see us from around the planet, and the dog will come in actually holding up the leg. And they're like, well, he doesn't seem painful. I think he's okay. He doesn't seem like he's in pain. The dog doesn't prefer, it's not his desire to go around trying to hobble on three legs. He's holding that one up because he is painful, because something's going on. So many times it's just, it's not the owner's fault. They just, they don't know. And so when a dog comes in and they're doing this, head bobbing lameness, we know it's in the forelimb. To them, many times they just think, wow, his gait changed. Something seems off. We'll have it looked into. They don't realize it's something, you're talking about puppies, that's genetic, congenital, and very quickly is leading to a condition that needs to be treated. So you're like Deb was saying, hopping around, holding up the legs, slow to get up, head bobbing. Those are all indications. The dog usually goes for the walk, a mile with the owner, and all of a sudden, a quarter mile in, they just sit down. And they're like, that's
Yeah.
not normal. So those types of cues usually start to tell the owner something doesn't seem right. In cats, I hate to jump into cats, but the number one sign that a cat has arthritis or an orthopedic issue, jump height. They can no longer jump up and onto the table or the countertop
So we
or even the
trained
bed.
them.
So all of a sudden the owners are like, oh, high five. We've finally trained the cat not to jump on things. No, the cat
Yeah, it's
physically
painful.
cannot jump on things. But it just shows, owners just don't understand. They can't talk to us, the dogs and the cats and the horses and everything else. So we
Check
really have to use your eyes and your gut. And some owners just are very, very good and say, you know what, something seems off. Something seems off.
Yeah, for sure. That's actually becoming a theme across, a lot of different topics. Is us as owners, we know our dogs individually, and a little bit of behavior change could actually mean that it's actually a really important early warning sign to be looking out for something else. And I think as an owner, we sometimes get that little bit of a gut feeling or intuition or whatever you want to call it of what it potentially could be, and then we could go, get more a second opinion from someone professional. So yeah, that's totally right. Uh, when we do find these early signs, especially more with puppies, maybe the genetics, is it always surgery that's going to be needed, or are there other ways that we can help as well?
There's so many different ways. My husband being an orthopedic surgeon, you would think that he wants to do surgery, and like literally half of the cases, we have a soft tissue or rehab option to do that. So there's not. It's even when surgery is indicated. So take hip dysplasia, right? So we have total hip orthopedic procedures that we can do for dogs. We can replace their hip, just like your grandmother can get her hip replaced. But not all dogs need that. And so what we do, say we have 50 dogs that are ready for a total hip, we enroll them in rehab and we call it prehab, right? So we're going to get them as strong as possible and as comfortable as possible. So when they're ready for the surgery, then they're in a much better shape. Half of those fall out. Half of them do wonderful with rehab and never need surgery. So it's quite amazing. There's so many different options. And so as an owner, you want to make sure that you're comfortable with the orthopedic surgeon that you're talking to and see that he has other options. It's not always surgery.
Yeah, you can always do surgery. You can't undo surgery. So even though I'm boarded in orthopedics and supported in sports rehab, I tend to try the conservative route first. And there's so many things like Deb was saying, from nutritional supplements to home exercises to in-house formal physical therapy or physio, all the way up to things like regenerative medicine. Let the body heal itself. Do things like stem cell therapy, platelet-rich plasmas, all these orthobiologics that are now available for our canine companions and athletes. Then we can always do surgery if we need to down the road. So let's try all the conservative options. And then if we need to, surgery is, of course, indicated for some situations, but you can always do surgery. Let's try conservative first.